Medical specialists are warning against a new eye-popping beauty trend. Eye tattooing and iris implants have become very popular with lots of buzz on social media. But researchers say these procedures are meant for those who are suffering, not for cosmetic purposes. Iris implants are approved by the FDA for patients missing some or all of the colored part of their eye because of injury or birth defect. The risks include infection, dye leakage into the eye, and even blindness. Joining me now is Dr. Janice Luk, a board member at BC Doctors of Optometry. Pardon me. Dr. Luk, thank you for being here. Could you tell us what these types of surgeries actually entail?
For sure. Thank you for having me, Renee. So these surgeries actually are meant to change the color of your eye permanently, and they are elective, so for aesthetic purposes.
So what is the reason with this sudden uptick in popularity?
I think color change for eye colors has always been something that's very popular in the eye care space, but recently there's been a lot of Instagram and TikTok social media reels that have really focused on, marketing these techniques, which is why it's become a lot more popular.
So can just anybody go and get a surgery like this?
From what I understand, they have to do a consultation first, but these surgeries were initially made for patients who have either trauma or birth defects or something that was medically necessary to have these iris or different implants or color placed in their eye. But now it's been adapted to be used for purely aesthetics.
What are some of the risks involved with this?
The risks can involve pain, light sensitivity, reaction to the pigment or whatever implant is placed into the eye. We don't know the long-term effects of some of the pigments that are placed into the cornea. And we also know that some of these risks with iris implants can be severe, like glaucoma or even blindness if not done correctly.
Is this something that you would recommend for somebody to get?
I would recommend if a patient is interested in getting a permanent eye color change surgery to talk to their local doctor of optometry to discuss the risks first.
Should there be more regulation, do you think, and monitoring of who's able to get these kind of eye surgeries?
It would be good to definitely get a little bit more regulation around these procedures.
And what makes you say that?
The potential risks might not outweigh the benefits. It is purely for aesthetic purposes. And additionally, these are elective procedures and the eye is a super delicate structure. So we want to protect it at all costs.
Any advice for anybody who's looking to or thinking about getting something like this done?
For sure. If you are interested in getting a permanent eye color change surgery, first of all, talk to your local optometrist and also consider speaking about a colored contact lens that is recommended by your optometrist instead.
All right, Dr. Janice Luk on the board with BC Doctors of Optometry. Thank you very much for being here. We appreciate your time.
Thank you for having me.